Hi everybody, welcome to my YouTube channel. Today's story is about Westmead Public Hospital, how they treat terminal cancer patients. They try to classify them as mental cases and then section them into Cumberland Mental Hospital next door. I'll just play you a recording of what happened to this poor gentleman who went there specifically for cancer treatment. He was of sound mind and all the faculties there, but the registrar and consultant there had other plans for him. They were both vindictive towards him because he'd made a previous complaint about another Chinese doctor. The consultant, this Chinese doctor, very, very nasty, vindictive person to subject this poor man through this. Anyway, I'll play it to you. It's self-evident what they've done.
I have time. So I need to ask you some questions. Okay, so I just need to ask you how you, and these are going to seem,
I just answered a bunch of questions from the other male doctor. I've done sketches for him.
I understand,
tests, so
but you want us to figure this out. We need to be as holistic as possible.
Holistic.
Yeah? So this is for the psychiatrist. They've asked us to do multiple questions and tests for you. That's he just did something that's called a specific examination. That's why he had the paper.
I understand.
Okay, so they're going to seem quite silly that I'm asking you.
I understand.
But just so I can relay it to the psychiatrist when she comes to see
I understand how it works.
So, I just wanted to ask how you've been feeling. I know you said you've been anxious. Would you agree with that?
Very unwell.
Yes, but your mood. How have you been feeling?
I've been feeling very unwell.
But that's how you physically feel? I'd like you to tell me a mood, like your mood. So have you been angry? Have you been...
Very, very unwell.
That's not a mood, sir. I've try to work
When
with
you're
me.
very unwell, that's how you feel.
Has that been making you feel...
Hands are soaking wet, sweat, my feet are soaking wet.
I understand that, but has that been making you feel particularly...
He felt like he was dying.
Because you did say you
I
felt...
don't know what it's making me. I just feel very, very unwell.
Okay, that's all right. Okay, sure thing. And I just want to ask you, these ones are going to seem a bit silly, but have you had any, delusions or hallucinations where you're seeing things that aren't there or anything like that? Or hearing things that aren't there?
No.
Yeah, okay, good. I know it sounds quite silly and you might be that's why you asked me.
I understand this.
He's trying to cooperate.
Things have to be done.
Okay, all right. And have you been... Okay, and can you tell me where we are right now?
Yeah, Westmead Hospital.
Good.
Emergency.
What time of the... Can you tell me what day it is today?
Today is Monday.
Good. And can you tell me... Okay. And can you tell me what your name is, sir? Good. Okay, perfect. And... That should be enough, actually, for me to be able to...
Look, I'm not a nutcase.
No, that's why I said this seems
His
a quite
doctors
silly
and
to you,
nurses tell lies to the
because I'm
patient.
asking you these questions, you're not.
No, but the implication is that there's something wrong with my brain. There's nothing wrong with my brain. I'm in pain here.
No, I understand
I'm in
that.
pain. My body's full of cancer.
I understand that,
I've
sir.
been given medication. I'm not too sure if it's doing any good for me or not.
I understand, sir.
And I'm not a nut job,
I know you're not, and that's why I prefaced asking this question by saying I know a lot of this is going to seem silly because it doesn't apply to you, but I need to be thorough.
I understand what you said, but the reasoning behind this is to see if I've got some mental problem.
No, I want to see if the pain you're feeling...
Before you implied that this was in my mind, this feeling.
I'm not saying it's in your mind, but I'm saying...
Before she said it was
I
psychosomatic.
want to know the underlying problem.
I know it's real,
in
sir.
his
I know.
mind.
If you're in pain...
It's not in my mind.
I understand. If you're in pain...
Don't talk, Melanie, all right?
If
He
you're
went
in
there for
pain...
cancer
I
pain.
want you to understand this, George. I believe you. I understand that you are in pain.
It's not a matter of here's a couple of Panadol, fix and go home.
I understand that. When when you say you're in pain, George, I want you to know that I hear you. I understand you're in pain. I'm not thinking that you're lying to me or making it up.
She's lying to the patient. She's not hearing him.
It's a funny pain.
Okay, I understand. George?
Just with another doctor.
I can't.
With the doctor.
What's the other doctor from the palliative care?
Yeah.
And the psychiatrists that are going to come as well. And
Hopefully, so I won't take the Zol off now. I just wait for the psychiatrist.
Yeah, I'll just double check with the registrar consultant, but I think it's best if it's to hold
if
up.
the psychiatrist said, you've got to maybe try changing it.
But she's a specialist. She'll know that stuff better. You know what I mean?
I know that, but if she says, maybe she'll suggest to change it, that means I've got to go through the whole lot of...
You can see what's happening there. This poor gentleman went there to get treatment, help for his cancer pain, and put him through psychiatric tests. The registrar consultant, it appears that this was
it's 5:30.
Not necessary, and this psychological test, he was there for cancer pain. Anyway, in short, the palliative care doctor came later on, and she saw the patient, and the patient told the doctor, what had happened, and that the registrar consultant and the other doctors, what they'd done testing, if he's got mental problems. And the palliative care doctor laughed. She said, no, that it's not in the mind, the pain, I can assure him of that. And she put her hand down around his chest area. She said, that's what the pain is, and it's through cancer. So it appears this vindictive doctors there, the registrar and a consultant, we're going to section this poor man into Cumberland Mental Hospital. And merely going to the hospital for cancer treatment. He had made a complaint before about another Chinese doctor there who mistreated him and made him ill there. So it appears that the registrar, Chinese doctor there, female, her friend that was complained about, is vindictive toward this man. What happened is the palliative care doctor said, for the emergency department, told the registrar he needs a drip put in, and that's it, And, however, the consultant registrar there, Dr. Mee Ling, the consultant, the registrar, Dr. Chris Cheeseman, came there and browbeated this patient, bullied him. And they got their nurses to bully him, which will be in another video. And a very loud voice, Dr. Cheeseman, very aggressively, very, not compassionate, couldn't care less. And, it's just, they were setting this man up, he believes, because, to do him, or put him through this psychological examination, is beyond belief. He went there for pain, for cancer pain. His mind was a sound mind of faculties, obviously. And he spoke very well, and he'd done his best, and they wanted to kick him out in the waiting room, and in the end result, he was thrown out by Dr. Cheeseman and Dr. Ling, and in fear of ever going back, there's more to the story, but that'll be in the next video. So look, if you have any complaints about Westmead Public Hospital or any other public hospital, you can use this channel as a platform, and if you can substantiate the comments you make, and it's good to have recordings because, you know, the hospital there, Westmead Public Hospital, has an unhealthy paranoia about recording devices, and obviously they've got a lot to hide. You know, if they had nothing to hide, we got nothing to fear. But you or your loved ones, if ever you should go to hospital one day, take a device with you with a fully charged battery, because these people lie. This patient made a complaint to the General Manager, the Chief Executive at Westmead Hospital, Dr. Graeham Loy, and the General Manager's name was Rebecca Tyson. They whitewashed the complaint and shredded it. There's a host of other things complaining about there, you know, criminal offences involved. Breaches of the Crimes Act, Section 1900. And he even complained to the Premier Gladys Berejiklian, the Health Minister and Research Minister Brad Hazzard, and he's just been fobbed off. It's just part of the cover-up. Westmead Hospital, public hospital, has got a long history of bullying, intimidation, and maltreatment. It's well documented. I'll provide that in another video. But it's in the public domain, so you can search that yourself. So the culture, the bullying culture, intimidation culture, and maltreatment is rife, still there. And I just ask you to be careful. And in fact, I would say don't even go there. Take your chances at home. So bad it is. It's so bad, and you can. I'd refer to that very bad doctor up in Bundaberg Hospital, Queensland, a while back. Dr. Jayant Patel from India, surgeon there. He killed over 100 people and maimed so many others. Anyway, he fled the country. But during the time he was there, many patients and families complained to the hospital about the treatment. And like with Westmead Hospital, the complaints were just shredded, fobbed off. They always try to blame the patient. You know, it's not always the patient's fault, but they always blame the patients. And had that hospital up there taken action in Bundaberg, you know, there may not have been 100 deaths. Might have been 20 or 10, even 10's too many. But there's obviously no scrutiny for these doctors coming in Australia. And I just wonder how many Dr. Patel's, Dr. Duffy's name was, in Westmead Public Hospital. It appears there's a lot of bad things going on there. Okay, thanks for watching the video, and comments are most welcome down below. And this channel's always here for you people who have complaints about hospitals, doctors, and you want a platform. Well, here it is. Okay then, all the best. Cheers.